Dr. Jane, go ahead and begin your presentation.
Thank you so much for inviting me this evening. I'm going to pull up some slides. I am the Assistant State Epidemiologist for South Carolina DHEC. This slide shows a graph of the number of new cases of COVID-19 every day, going all the way back to March of 2020. You can see that it went up during the summer of 2020, then down in the fall, then really hit a peak in January and February of 2021. In May and June, it was at an all-time low. We were seeing fewer than 100 cases per day in South Carolina. Unfortunately, now we are back up in a new peak. We're seeing the same number of new cases each day that we saw back in January. For most people with COVID-19, it is a mild to moderate illness. People have fever, cough, may feel a little short of breath, and they may feel achy all over. For most people, these symptoms last 10 days, maybe 2 weeks, and then go away. Unfortunately, some people have severe COVID-19 disease. COVID-19 can affect not just your lungs, but also your heart, your liver, your kidneys. It can even cause inflammation of your brain. And if you're pregnant and have COVID-19, you have a higher risk of losing your baby and of multiple complications for the mother and the unborn child. We need to talk a little bit about the biology of this virus so that you can understand how the vaccines work and understand how you can make decisions about whether you want to get vaccinated. On this slide, I show a cartoon, a drawing of what the virus looks like under the microscope. The most important thing to know about this virus in terms of vaccine is that there is a protein on the surface called a spike protein. That spike protein attaches to human cells and injects the virus genetic code, the virus's genes, into the cell to make more virus. I want to mention a little bit about terms, the words we use about this disease. SARS-CoV-2 is the name of the virus. COVID-19 is the name of the disease. Let's talk a little bit about how vaccines work. First, I want to talk about how vaccines do not work. Sometimes people think when they get a vaccine that it's like they now have a magic shield all around them so that the virus doesn't get into their system, it just bounces off the shield. That's not true. Vaccines don't work by putting you in a magic bubble where the virus just bounces off. Instead, the way vaccines work is to stimulate your immune system so that it can respond more quickly to the virus. In this picture, which we will look at in a minute, the virus spike protein is the most important part of the vaccine. The vaccines do not contain whole virus. They do not contain the SARS-CoV-2 virus. The only thing they contain is the gene for that spike protein. That gene for the spike protein is made into a vaccine, injected into someone's arm, and it stimulates the immune system to make antibodies, to respond, to fight against that spike protein and prevent the virus from even getting into the cells. I'll give you a moment to look at the drawing. What about breakthrough cases? We have read in the news about people who have been vaccinated, but they got COVID-19 anyway. Does that mean that the vaccine is no good? No, it doesn't. Remember, I said you can still get the virus. You're not in a magic bubble where the virus just bounces off. What vaccine does is it allows your body to respond to the infection quickly and get rid of the virus so that you don't get as much severe disease. You may get mild symptoms and it may prevent infection in many people, but it's not 100%. SARS-CoV-2 is a respiratory virus. That means it gets into your body through your nasal passages, your mouth, your lungs, and even in through your eyes. When somebody who has the infection coughs or sneezes, or even is speaking or breathing in and out, but you are very close by, you may breathe in some of those virus particles. The virus gets into your respiratory system. If you're vaccinated, your immune system responds quickly, and you may never have symptoms, or you may get mild illness, but your body will fight it off very quickly. So it is possible for a person who's been fully vaccinated to have a breakthrough case, but most of them are very mild. Most of them do not progress. By far, the majority of people who have COVID-19 in South Carolina and in the United States are unvaccinated. This is what it looks like if you do not have a vaccine and you're not immune. The virus enters your respiratory system and it can get into your human cells to cause infection. This is what it looks like if you're vaccinated and immune. Your body makes antibodies to that virus. And it sends some special immune system cells to go and find that virus, gobble it up, eat it literally, and destroy it so that you don't get serious illness. So how many breakthrough cases are we having? Breakthrough cases are rare, and they usually occur in people who have a weaker immune system, people who were vaccinated, but because they're older or because they have immune problems, their immune systems are weakened, they don't respond as well. Even with a vaccine, they don't respond as well. In my next slide, I'm going to show you some numbers from the Medical University of South Carolina in Charleston. It's one of our larger hospitals that has been admitting people with COVID-19 with severe disease, admitting them to the hospital, to the intensive care unit, and sometimes placing them on a ventilator or breathing machine. Most of those people are unvaccinated. Some have been vaccinated but are breakthrough cases. Let's look at those numbers and then talk about who those breakthrough cases are. In this slide, the orange figures are people who are unvaccinated. They are far and away the main number, the largest number of people who are hospitalized in the intensive care unit or needing a ventilator. The few people who were vaccinated, who are seriously ill or who needed a ventilator, were either over age 70 or they had multiple medical conditions like diabetes or kidney disease, or they were immunocompromised. By that, I mean they have a weakened immune system. They might be someone who had a kidney transplant, who is now on strong medication to suppress their immune system to keep them from rejecting that kidney. The important thing to understand is that almost all of the new cases we are seeing in South Carolina, and certainly the majority of the serious cases, are among people who have not been vaccinated. One of the most common questions I hear is, how can a vaccine made so fast be safe and effective? I'd like to talk a little bit about how this vaccine was made and vaccines in general. How was it possible for this vaccine to be made so quickly? Most vaccines take several years to be made. The second fastest vaccine ever made was the measles vaccine, which took 4 years. So how is it this vaccine only took less than a year? Well, it didn't take just less than a year. The basic science research on this vaccine goes back many years earlier. There are 3 stages to making a vaccine. The first stage is the basic science research. What do we know about this virus? Where are its weak points? How can we make a vaccine and make medications to fight it? The second stage is testing it in animals, rodents, as well as monkeys. And then the third stage, after it's proven safe in animals and proven effective in animals, it gets tested in humans. The basic science research is far and away the longest stage. Do you know when that began? For coronaviruses, for SARS-CoV-2, that basic science research began in 2003 with severe acute respiratory syndrome, the original SARS-CoV-1 virus. This virus is genetically very similar to SARS-CoV-2. There was an outbreak, a pandemic in 2003. About 8,000 people were infected and 800 died. There were cases in the United States. Fortunately, they were able to contain that pandemic and it died out. It stopped. We have not seen more cases of SARS, the original SARS virus. But we've had all those years of basic science to build on, because scientists knew, vaccine companies, academic centers, the NIH and CDC all knew that there was a chance a related virus would come about. So they've been working on vaccine since 2003. When SARS-CoV-2 was first described in January of 2020, they sequenced the genetic code. They figured out the exact number of genes and figured out how that was different from the genes of SARS-CoV-1. So they could target a vaccine exactly to that spike protein to make sure they had the most powerful immune response possible. They were able to test the vaccine in animals as early as February of 2020, and then could test it in humans starting as early as March of 2020. No steps were skipped in the development of this vaccine. Remember, we had many years of basic science research that helped substantially in making a targeted vaccine. The other thing that was different in creating this vaccine were the way they ran the human studies. When you do human studies, they are expensive. You have to pay the doctors to examine the patients. You have to pay for laboratory tests. You have to pay the people who participate in the study. You need to reimburse them for their time. So normally, vaccine companies do just a few hundred people at a time. They want to make sure that they have a product that is worth spending all that money on before they recruit thousands of people. What was different here is that our government and the governments of many other countries around the world invested. They paid money to the companies saying, go ahead, recruit as thousands of people into your studies now. Don't drag this out over several years. Get them involved in your studies now. And in fact, for the human studies, for Pfizer and Moderna, they were able to get tens of thousands of people involved in their phase 3 study in just 2 months. That's never happened before. That was not because it was rushed. It's because these steps were overlapping, that they didn't wait to see how the study went in just 500 people before they recruited the next 500. No, they recruited tens of thousands of people in just 2 months. No steps were skipped or hurried up. How effective are these vaccines? The Pfizer and Moderna vaccines are extremely effective. They give you 95% protection 2 weeks after the second shot. You do have to get both shots for them to give you the full effectiveness. There is a third vaccine, the Johnson & Johnson vaccine. This was designed as a one-shot vaccine, a single dose. It is a little less effective than Pfizer and Moderna, but then again, it is only one dose. It will give you 85% protection against severe disease after just that one dose. They are doing studies right now to see if a second dose would give you higher protection. It does look like a second dose would give you higher protection with the Johnson & Johnson vaccine. But for people who just want one shot and be done with it, this is a good choice. Right now, Pfizer is the only vaccine that has full FDA approval for people age 16 and up. I'd like to talk a little about what is the difference between an emergency use authorization, or an EUA, and full FDA approval. For both the EUA and full approval, you have to do all the same science studies. You have to do all the same animal studies. You have to do all the same phase 1, 2, 3 human studies. The only difference between an EUA and full approval is the amount of time in safety follow-up. For an EUA, you need a minimum of 2 months of safety follow-up. That means after the phase 3 study is done in humans, you need to continue to follow them for another 2 months. Why did they pick 2 months? They didn't just make that number up. Most side effects from vaccines show up in the first 6 weeks after getting a vaccine. We know that from our more than 100 years of experience with other vaccines. Side effects, if they're going to occur, they happen in the first 6 weeks. So the FDA felt confident if we didn't have any serious safety issues in the first 2 months, it would be worthwhile to release this vaccine early so that more people could benefit. If they did not do that, there may have been hundreds of thousands more people could have died. For full approval, you need at least a minimum of 6 months of safety data. Pfizer, in fact, gave FDA 1 year's worth of safety data because they followed the people in the phase 3 studies for a full year. Plus, we had safety data on all the people who got the vaccine since December under the EUA. These vaccines have been shown to be not only highly effective, but very, very safe. There have been very few serious bad reactions to these vaccines. Each of us has to make a decision that is personal about whether they want to get vaccinated. We have to weigh the risks and benefits. The benefit of the vaccine, as I told you, is very high. The risk of COVID-19 disease can be substantial. Most people have mild or moderate disease, but some people have severe disease. And I think you know that many people have died from COVID-19, and not just very old people or people with many medical problems. We have had previously healthy young adults die from COVID-19. So each of us, when we make a decision, you have to compare the benefit of the vaccine and your personal risk of being exposed to COVID-19. And if you were exposed, whether you would have serious illness. There are some common vaccine side effects, symptoms people feel the next day after they've been vaccinated, such as feeling tired all over, or having pain or swelling at the site of the injection, fever or chills, or a headache. Not everyone experiences these feelings, but many people do. This is common. Sometimes side effects like this are common with other vaccines. For example, the shingles vaccine. The shingles vaccine does create the same kind of side effects, and on average are even a little bit worse than the side effects most people feel with the COVID-19 vaccine. But why do you feel symptoms at all? It's because the vaccine is stimulating your immune system. And when it stimulates your immune system, you get some inflammation at the site of the shot. But then as the vaccine starts to stimulate your total body immune system, you get some other types of inflammation. It's actually a sign that the vaccine is working. There is one vaccine side effect in particular I want to mention, and that is a rare condition of heart inflammation. It's called myocarditis. Myocarditis sounds very scary, an inflammation of the heart muscle, but it can be mild. It can be some mild feeling of chest discomfort, mild feeling of shortness of breath because of some inflammation. This is a rare condition. It is about 16 cases per 1 million doses of vaccine. This is rare. It's temporary. It goes away completely. It is treatable with anti-inflammatories such as ibuprofen. There have been 0 deaths associated with the vaccine and myocarditis. There have been 0 deaths from allergic reaction to the vaccine. Let's talk a little about boosters. There are 2 types of 3rd doses of vaccine. Right now, the FDA has authorized use of a 3rd dose in people who are immunocompromised, people who have a weakened immune system. The reason for this is that the first 2 doses did not give them a strong immune response because they have a weak immune system to begin with. So you want to give them a 3rd dose of vaccine as soon as you can. You need to wait at least 28 days between the 2nd dose and the 3rd dose, but these people do not need to wait to get a booster. As long as 28 days have gone by after their 2nd dose, they can get this 3rd dose of vaccine. Who are these people who have weakened immune systems? People who have cancer, for example. I don't mean people who had cancer 5 years ago and are now recovered. I mean people who are currently undergoing cancer treatment with radiation or with chemotherapy, strong medications that may suppress the immune system. I also mean people who have had organ transplants, kidney transplant, cornea transplant, heart transplant. Any of those transplant people are also on medicine to suppress their immune system so they don't reject that organ transplant. They need a 3rd dose of vaccine. And lastly, people who are on prednisone, at least 20 milligrams or more a day. Those are people who have autoimmune diseases like lupus or rheumatoid arthritis, and they need to take high doses of these steroids every day. They need a 3rd dose of vaccine. What about boosters for everybody else? We're still gathering information on that. The FDA and CDC are looking at data right now to determine, does everyone need a booster? Do only certain people need boosters? Perhaps people over age 65, or perhaps people who have medical conditions like diabetes. Does a young, healthy person need a booster? We need to look at the science to decide. And what is the best timing for a booster? Should it be 6 months after your last dose of vaccine? Should it be 8 months? CDC and FDA are looking at that data now. FDA has said they plan to release their recommendations next week on Friday, September 17th, about who should get boosters and when they should get boosters. I'm going to wait until I hear those recommendations before I get my booster. I want to know what is the best timing for my booster dose to get the most benefit. Now I want to move away from vaccine for a moment and talk about a worrisome trend. There is a medication by the name of ivermectin. This medication is used mostly in animals. It is a horse and cow dewormer. It gets rid of their worms. Some people use it for their dogs to prevent heartworm infection. There were some studies in countries overseas like India and Iran that found ivermectin may benefit COVID patients. That's not been completely proven. It's a theory. And remember that in Iran and India, many people do have parasites such as worms, and maybe it did benefit them by getting rid of their worms. They were better able to fight off their COVID infection. The worrisome thing here is that some people are taking animal ivermectin because they think that will help them. Well, number one, the dose is wrong. If you're taking medicine that is dosed for a horse or a cow, you could take a terrible overdose. And even if you're taking just your dog's heartworm pills, remember, those heartworm pills were never tested in humans. They're tested in dogs. They may not have the same effect in humans. And in fact, we are seeing in the emergency rooms in South Carolina, people coming in with severe symptoms after taking ivermectin. The FDA has come out with this statement: you're not a horse, you are not a cow. Do not take medicines that were made for animals. This is a medicine that can interfere with many other medications. It can interact with heart medications, seizure medications, blood thinner medications. So you don't want to take this medication except under the direct care of a physician. Right now, there is no evidence in the United States that ivermectin will help you get over COVID-19 faster or prevent you from getting infected. The best prevention against COVID-19 is vaccination. There is another treatment I want to mention, something called monoclonal antibodies. These are passive antibodies, antibodies that were made in a laboratory and then put into an IV, intravenous, and then can be given to you by an IV or an injection under your skin. When you get vaccinated, your body makes its own antibodies. But if you are sick, whether you're vaccinated or not, if you are sick with COVID and at high risk of severe disease, maybe because you have medical conditions or you're older, you can also get an extra boost from these monoclonal antibodies. You have to get your doctor to prescribe them. So if you test positive for COVID-19, talk to your doctor, ask about these passive antibodies, ask about the antibodies that can be given in your vein. Even if you've already been vaccinated and you're one of those rare breakthrough cases, you can benefit from these monoclonal antibodies. They have been shown to be 70% effective in keeping people out of the hospital, and they're highly effective in preventing severe disease. Another common question I hear is, do I need the COVID-19 vaccine if I already had COVID? If you already had COVID, you have some immune response. You are partially protected from getting infected again. but there are many studies out there that show that there continues to be added benefit if you get vaccinated. So if you've already had COVID, you have partial protection, but wouldn't you want to increase that protection, to have more complete protection? You can by boosting your immune system with the vaccine. And remember, if you had COVID-19 more than 3 months ago, it probably was not the Delta variant. It was probably a different variant. And you may have antibodies, but those antibodies may not be as effective against the Delta variant. The vaccines were all specifically designed to attack all of the variants and to give you a very high level of antibodies, as well as stimulate some other immune cells in your body called B and T memory cells. So if you've already had COVID, we would still highly recommend that you get vaccinated. While we're talking about vaccines, I want to remind you that flu season is upon us, and it is important to get your flu shot. Highly recommended that you get your flu shot before the end of October. It is not too early to get your flu shot now. And you can get the flu shot and the COVID vaccine at the same time. You don't need to separate them out by days or weeks. You can get them at the same time. Probably you would want to get one shot in one arm and the other shot in the other arm, but you can get them at the same time. It's really important that people understand that your flu shot is part of COVID prevention. If you got the flu, it would lower your resistance. You would be more vulnerable to also getting COVID-19. So please, this may be the most important flu shot of your life. There are two things I want you to know about Delta. Delta variant spreads more easily. It is more contagious. The Delta variant has several mutations from the original virus that allow it to have higher viral loads, a higher amount of virus in your respiratory system, and it causes a person to become contagious faster. So the Delta variant spreads more easily. The other important thing to know is that the vaccines all work against the Delta variant. They work against all of the variants that are currently circulating in South Carolina and in the United States. You may have heard about some other variants. There's one called Lambda. There's one called Mu. There are other variants, but they are not the predominant ones in the United States. More than 95% of the new infections in South Carolina are Delta variant. And vaccine works. The monoclonal antibodies, they also work against the Delta variant. I'm going to end on this slide with my email address, because if we don't answer your questions tonight, you can always email me directly. My email is kellydjm1@dhec.sc.gov. Thank you so much for joining me this evening. I think I will stop sharing my screen and we will turn to the questions. I'm looking, I see that there are a number of questions in the chat box, or I'm just reading through them, and then we'll see how many of these we can answer. So the first question I see is, If people had COVID before and still have antibodies, should they get a booster or a vaccine? And I think we have discussed this, that it is still highly recommended. Even if you had COVID before and you had antibodies, you will get additional protection by getting the vaccine. How long has this experimental injection actually been tested in humans? They started in the United States. They started the first human studies in March of 2020. So we have about a year and a half of information on those individuals who were in that first phase 1 study. I see someone says the vaccine doesn't work. In my experience, the vaccine is highly effective. So I'm not sure what this concern is. It may be because there are some breakthrough cases. I hope people understand that having a vaccine does not give you just a shield that virus bounces off from. What vaccine does is prevent you from getting severe disease. So you can breathe in the virus, get a temporary infection, but you get rid of it faster. You're less likely to have severe disease. I'm sorry that this person thinks that this is total BS. I think that there are many, many studies in published literature. I'm not talking about newspaper headlines. I'm not talking about reports. I'm not talking about information that people share on social media. Let me talk just for a minute about what it means to get something published in a journal like Science or Nature or the New England Journal of Medicine or the Lancet. The Lancet is out of England. All of those journals are not magazines. They're not like National Geographic. They are peer reviewed. By that, I mean, if I write an article, I do a study, and I write an article about my study, and I send it into Science, they then have statisticians, they have immunologists, they have virus scientists review what I have sent in, and they double check to make sure my statistics are right, my math is right, that I did the study correctly, that if they have any questions where something doesn't seem quite accurate, doesn't seem right, they then come back to me and say, you need to do this study over, or you need more people in your study. You know, they give me feedback. Science will not just publish my paper. No, they have experts review it. Experts give me feedback. If I can satisfy them by giving them more information, only then will it be published. So to say that this is total BS means that all of those major scientific journals are not doing their jobs. And I think they are. Certainly there are things that slip through. Certainly sometimes there are mistakes and there is a retraction of an article, but far and away, I think there is good science about this. And in terms of the vaccinated ones are the ones who are spreading it, breakthrough cases are rare. They do happen. It is true that sometimes you'll have someone who was fully vaccinated, gets COVID-19, they are contagious, they could spread it to others. I'm not denying that. I'm saying it's rare. Far and away, most cases are among people who are not vaccinated. I'm just reading through some of these. Well, I see there are a lot of concerns that this is not, the information I'm providing is not true. The information I'm providing, though, is not my opinion. My job tonight is not to convince you about vaccine. That's an individual decision. My job tonight is to present you with the science, with what is known, what data we have. And I know sometimes it's frustrating because when we learn something new, when a new study comes out, it changes some of the information. For example, at one point, I think the science looked like we might need boosters as soon as 6 months. Now the science shows it might be more like 8 months. You know, I know that this is complicated because People are living at a time where the science is going on in real time. Oh, I hear someone say Dr. Jane Kelly is reading off a script that is provided to her by the government. I can absolutely attest to the fact that I made each of these slides myself. No one scripted this other than myself, and that I do work for the government, but I came out of retirement. I'm not doing this job because I need the money. I literally was retired from the Centers for Disease Control and Prevention, but this was so important that I came out of retirement to do this. So I'm sorry that you don't feel my facts are actual facts. I can provide links to the slides for the data, for the papers that provide the evidence. Are there any side effects, or what can people be allergic to? What's in the vaccine? That's a very good question. Thank you for asking that. For Pfizer and Moderna, they have an ingredient called PEG, polyethylene glycol. Sorry, it's a long term. It is a common ingredient in certain over-the-counter laxatives, such as Colace.
Dr. Kelly, I'm sorry.
Yes.
Would you say the name of that again, please?
Yeah, and I can put it in the chat box. Maybe that's helpful. Polyethylene glycol. I'll put it in the chat box. Most people are not allergic to this, but some people are, and they know it if they are allergic because they had an allergic reaction to a laxative. There is another vaccine, and that is the Janssen or Johnson & Johnson vaccine. I'm going to put in the chat box the ingredient that some people are allergic to in that vaccine. It's something called polysorbate 80. It is a common ingredient in certain foods like ice cream and salad dressing. So again, most people are not allergic to it, but some are. There have been some serious allergic reactions to each of these vaccines. It's about 1 to 5 people per 1 million doses of vaccine. And any place you go to get vaccinated, they will have the people and the medications available to treat you if you have an allergic reaction. No one has died from an allergic reaction. Some people have had it and had to be treated with medication. Does the booster have to be the same type of shot as you got originally? I do want to wait myself until I hear from FDA and CDC what they recommend. I think that they will recommend that you should get the same type of shot as you got originally. But Pfizer and Moderna are very, very similar. So if, for example, it was time to get your booster and for some reason you couldn't get the same one you got before, it probably will be fine to go ahead and get the other one. But in general, you do want to stick with the vaccine that you started with. Where are we with vaccine for children under 12? I heard today that it is likely that Pfizer will have all their phase 3 studies in children completed by the end of September and be able to submit their application to the FDA by the end of September, maybe early October. And it will probably take FDA several weeks, maybe a month, to review all that data. So we are hopeful that we will have at least the Pfizer vaccine for children under 12 available by November. Moderna is taking a little bit longer because they are also trying to do some things with different doses. They probably will not have their paperwork together until end of October, early November, which would mean vaccine availability maybe by the end of December. Will the general population be able to get a booster shot? And again, we have to wait until September 17th to hear exactly what FDA recommends. I would hate to see someone run out to get a booster shot right now and then find out, oh, I got it too early. I should have waited to get the best result from it. So I feel with just 1 week to wait, I can wait to find out whether I should get my booster. On the other hand, if somebody is on prednisone right now, that's the medicine that is a steroid. People take high doses of it for certain medical conditions or sometimes for really severe asthma. If you're on prednisone now, 20 milligrams or more, yes, you should go ahead and get your third dose now, but not if you were on it in the past and you're off it now. I see apologies for some of the questions that were asked. I want people to feel free to ask any question that and not worry about offending me. There are a lot of important questions out there. Then there's no silly question. All questions I will be happy to entertain. I think I have answered all the questions that are in the chat box. It looks like there may be something in Q&A. People who had COVID before still have antibodies. Should they get the booster or the vaccine? I think we've talked about that, I would highly recommend, even if you have antibodies, to still get the vaccine because it will give you a higher level of antibodies and it will also stimulate your B and T memory cells. Did I miss any questions? Oh, if you got questions live, that'd be great.
See, I have my hand up here. Okay, I'm sorry. I've been struggling to get Zoom. I got on late. Amy? I think they're waiting for you to get your picture enlarged so we can see you clearly. Hold on 1 minute. Anita's still making adjustments. Hold on just one moment. We're trying to get all this figured out. Okay, I'll piggyback what you're saying. Anita will piggyback and I'll also piggyback. I know that there's two people and there's me and another one named Elaine. Iris Maher. Is it Elaine or Iris? Which one you want to ask the first question? I'm looking at you, Iris. Yes. Okay. Yes. All right. I'll go ahead and ask my question first. Okay. I'm sorry I got on this Zoom late because I had struggles getting it to connect, but I'm on now. And so I may ask something that's already been discussed, but my question is this. A friend of mine was telling me, and it's kind of puzzling. They were saying that before Pfizer and Moderna started their vaccines, they were giving the shingles vaccine and they were given other vaccines like, you got when you were little, like I had MMR and mumps and all these different things. You know what I'm talking about. And I was kind of puzzled. And these people are saying that you need to get the injection for shingles. I've never had that. I've already had all the COVID vaccines. Is it okay for me to get that? I haven't had the shingles vaccine.
The shingles vaccine is usually recommended for older adults. It is not a required vaccine for younger adults. As people get older, their immune system starts to become just
Yeah, I'm
naturally
62.
weaker. And so at 62, I would recommend getting the shingles vaccine, but not just because of COVID. I would recommend that as routine. I got the shingles vaccine. The shingles vaccine is recommended. I think I'd have to look it up. I think it's for age 55 and older. I'd have to look that up, and I don't want to misquote, but definitely if you are 62, you're definitely eligible for the shingles vaccine. And I would recommend it even if we didn't have COVID going on.
I did want it, but I wasn't sure if I should take it or not.
It's safe. It does give you some symptoms. I had I'm just giving you my personal experience with it, that my arm hurt and I felt under the weather for a day. I didn't feel great. So I got it on a Friday afternoon so that if I needed to sleep late on Saturday, I could. But shingles is a bad condition. It can give you severe pain and a severe rash that can last a long time. So I would highly recommend getting the shingles vaccine. You can get your shingles vaccine and your COVID vaccine on the same day. My mother-in-law did that. She got both of them on the same day, different arms, but she wanted to get it just all over with at once.
Elaine, question. Iris, I'm sorry. Yes, I have a second question. This is the last one. Why are people, including doctors and nurses, why are so many different people refusing to take the COVID vaccine? This is puzzling to me. And why is Dr. Fauci going back and forth on this? It's really confusing. I've just decided not to pay any attention to him. And is he for real? I'm really concerned about all the different things that I'm hearing. You know, doctors and nurses are saying you should get it. Others are saying no. And I'm wondering why this is.
I know this is a very confusing time. One statistic I'd like to quote is that 97% of American physicians have been vaccinated. I think that speaks for itself. I know the number is lower for nurses, and I think that the group that has been the most highly vaccinated are physicians. So you can take that into consideration. You know, do you think that they are in a better position to judge the safety and effectiveness of vaccines? I know that there has been communication that has gone back and forth. Do masks work? Yes or no? And I know that that has been a source of frustration. In the very beginning of this pandemic, we didn't know a lot about this virus. This virus is genetically very close to SARS-CoV-1, but it acts differently. Its genetic code is very similar, but it gives you severe disease, not just in the lungs. It gives you severe disease in multiple other organs of your body. The original SARS didn't do that. The original SARS gave you pneumonia and not all these other conditions. So some of the confusion is because we were learning as fast as we could. And so each day when a new study would come out with new information, the recommendations would change because now we had new information that we didn't have before. But I know that that can be very confusing and frustrating and sound like nobody knows what they're doing. It's that dealing with new information as it rolls in has just been a real challenge for everyone. Dr. Fauci, I actually met in person in the early 1980s, and he has been at NIH, the National Institutes of Health, for more than 40 years at this point. So when we ask, is he for real? I would like to point out that he has a great many years of experience in immunology and in the prevention of diseases, and he works with a fabulous team of scientists. But the amount of work that has needed to be done has been tremendous on this virus. You know, think about how many years of research went into polio before we had a polio virus. A lot of this has been molecular biology, you know, new scientific techniques that we never had before. So in answer to your question, feeling like you don't know who to trust or what to think, number one, I would say, remember 97% of physicians have been vaccinated. So they have a lot of confidence in this vaccine. Many of the people who have enrolled their children who are under age 12 in vaccine trials are physicians and scientists who, again, have enough confidence in the vaccine for adults that they want to get that vaccine for their children as soon as possible. So they've been enrolling them in studies. What are some of the reasons other people have not been vaccinated? Why are some people vaccine hesitant? There are a lot of reasons. In the very beginning, many people felt this is just too new. I just want to wait. And indeed, many people waited and then finally got vaccinated this summer when they realized, okay, it's been out for more than 6 months. People seem to be doing okay. My doctor got vaccinated and he didn't get sick, or my neighbor got vaccinated and she didn't get sick. And they felt that they now had enough information to go ahead. Other people don't get vaccinated because they don't find it a priority. Some people feel I'm young and strong, and I think if I get this COVID-19, I'll just have a mild virus, no big deal. I'm not going to bother getting vaccinated. So that's a big reason why many people are not vaccinated, not because they're afraid, but because they just think it's not important. Some people are afraid, however. They read things on social media. There are rumors that get spread. Rumors have always been around. But there were rumors about polio virus in the 1950s causing fertility problems that it didn't pan out. But that's what people were talking about. The same sorts of rumors that go on today. What's different, though, is in the 1950s, those rumors would spread, you know, word of mouth, one person at a time, or one newspaper headline at a time. With social media, anybody can post anything on social media, and they don't have to provide any backup for what they're claiming. So some of the claims I have seen have been, you know, seem to me really absurd. So for example, the people who've said, oh, when they give you that shot, they're actually injecting you with a chip so that they can follow you. You know, to me, that seems great, like a crazy idea. But for some people, that's a terrifying idea. And they you know, hear those things and don't know what to do. My best advice is to look to credible sources. By that, I mean, don't get your information from social media. Sometimes social media is really helpful. You know, you learn something that early on, or you can connect with other people who are feeling the same fears you are, but don't get your facts from social media. Get your facts from other sources. If you don't like the government and you don't want to get your facts from DHEC or from CDC, that's fine. There are other sources. You can get your information from Johns Hopkins University, their school. You can Google their School of Public Health. They have a lot of information on their website about COVID-19, about vaccines. You can get information from other countries. You can get information from Canada or from England. What are they doing about COVID-19? You know, what information do they have in their healthcare systems? Or again, if you don't like government, you can talk to the London School of Tropical Medicine. You can talk to Harvard University. They all have websites on COVID-19. Massachusetts Institute of Technology, MIT, they are running courses on COVID-19. They have a website with a lot of information as well. If you find, if you find me a credible source. You're more than welcome. We can have an email exchange, but I understand if that there has been some sentiment that people don't want to talk to DHEC, and I respect that too. But if you want to have a direct discussion with me at any time, I would be glad to do so. Or if not me, I can connect you with someone else. I hope that helps.
Thank you. Thank you. Okay, you turn your camera off.
Turn my camera off?
No, the Iris Maher.
Ah.
Looking now for the next question. Yes, please turn your camera off, Iris Maher. Yes. Please turn your video off. No, not Melissa. Okay. Melissa, she has a question. Hello, I'm deafblind. And I have a hard time figuring out where the truth is. There's all kinds of different things, and so much information is out there, but how do I know what's best, with the vaccine itself?
It is difficult for people to know what information to believe. I think your best source of information is your doctor. You can also consult with a pharmacist. I think they are the two best sources of information. If you are worried about something in particular, you can also email me directly. I'd be glad to help. I can put my email address in the chat box.
Okay, I have one more question for you. I've learned that with the vaccine itself, each one, they have different side effects. Is it true that the vaccine itself causes paralysis?
No, it is not true that the vaccine causes paralysis. There has been a problem with some places, this is rare, but there has been a problem with people getting the vaccine in the wrong part of the arm where the needle touched a nerve in the arm. That's not the vaccine's fault. That was an incorrect administration of vaccine. That is rare. That should not happen. Nurses and pharmacists, people who give vaccines, are well trained in how to do that. Fortunately, that has been very rare to see people have that temporary nerve damage. It's not from the vaccine. It's because the shot was given in the wrong part. The shot should be given in the muscle of your arm, not on the inner arm, not all the way up in the shoulder, given into that big muscle on your arm. It is not vaccine ingredients that can cause that problem. It's that the needle was put in the wrong place. I know people are afraid of getting the vaccine. What worries me is that if you decide you're too afraid to act and get the vaccine, you're still making a decision. You're deciding that you accept the risk of getting COVID-19, the disease. More than 330 million doses of the vaccines have been given out, and really only a handful of people have had complications. Many people have felt a sore arm or didn't feel well the next day, but I would rather trade one day of not feeling great and rather than have COVID-19, the disease. It might help if you talk to other people who have had the vaccine. What did they experience? I can tell you my story. You know, it was, for me, it was not as bad as the shingles shot. It was like in between the flu shot and the shingles shot. I had a sore arm. I guess I was a little tired the next day, but it was, for me, it was not that big a deal. I know other people say they had to go to bed for a day or two, but it's temporary. Whereas unfortunately, the damage that COVID can do can be permanent.
Also, my doctor told me that it's not a good idea for me to have the vaccine because maybe allergic to something in the ingredients. So what are my other options for people like that?
So, you know, it is always appropriate to get a second opinion. Your doctor may know you well and may be giving you advice, good advice, but he may not understand as much about the vaccine as some others. Maybe you're someone who has a lot of allergies. If so, you could take some Benadryl ahead of time before you get vaccinated. Anytime I have to make a serious medical decision, and I'm a physician, but if I have to make a serious medical decision about my health, I get a second opinion. Most allergic reactions are very treatable. Even if you have an allergic reaction, they will have the medications on hand to treat it.
Thank you so much for answering my questions. I really appreciate it.
You're welcome.
Thank you, Melissa. Now we'll see who has the next question. We have some on the chat. It looks like that's it. Okay. Thank you so much for joining us for our webinar today. It was really wonderful, very interesting and informative. Thank you so much to everyone who asked questions and for all the answers we received. Thank you also to Dr. Jane Kelly for a wonderful presentation. Thank you to CDI interpreter. Thank you to the hearing interpreters as well. Thank you so very much to everyone. Be safe. Thank you. Bye-bye.
Thank you, everyone.